Welcome to Care for Your Health's annual report for 2023. We'll begin with the letter from our executive director.
The end of the COVID-19 era has been a roller coaster for the organization. With the fear of infection subsiding, the interest in our hardworking communities, and the support toward their health and well-being has all but disappeared. As first-hand witnesses to the devastating need for primary care following the pandemic, we transformed the COVID-19 infrastructure into pop-up community clinics strategically located to deliver essential services. These clinics operated in Montgomery and Prince George's counties throughout 2023. We have also begun discussions to open our first pop-up clinic in Howard County. The shifts in services we have undertaken in response to community needs have expanded our patient population to include younger individuals in the pop-up clinics. The demand for elderly services has continued to grow, allowing us to expand our home-based services and the continuation of our hospital at home and grief counseling programs. Despite the increase in needs in the community, funding has been lacking. As a result, we anticipate a bumpy ride in 2024. However, this only increases our determination. We are working together with community partners toward a unified goal: to eliminate societal inequalities and achieve social justice. Despite the many challenges, we are continuously changing and adapting to bring the human right that is healthcare and its scientific advances to all people without exclusion nor discrimination.
Let me introduce you to the community we serve. In 2023, 80% of the patients we served were Hispanic. Also, 60% of our patients were female and 40% were male. Regarding the age of the people we serve, 3% were children, 73% adults, and 24% were elders. Finally, 74% of our patients prefer to speak in Spanish, 19% prefer to speak in English, and 7% prefer to receive services in other languages. Our primary services remain centered around delivering comprehensive primary care, which we provide in various settings, including our office, the community, and directly in patients' homes. In 2023, we served a total of 1,835 patients, each receiving an average of 2.1 visits, amounting to a total of 3,896 visits throughout the year. This reflects our commitment to accessible and personalized healthcare, ensuring that our patients receive the necessary care where and when they need it most. About a third of our patients have hyperlipidemia, while another third suffer from hypertension. Additionally, a quarter of our patients have musculoskeletal disorders, and a fifth are affected by gastrointestinal ailments. Notably, 17% of our patients have diabetes, and 4% are living with dementia. Although only 17% of our patients have diabetes, they account for a third of our total visits, a pattern that is similarly observed with patients suffering from gastrointestinal issues. At home, patients present an average of 8.3 diagnoses per visit, with a disease prevalence that differs significantly from those seen in the office and community settings. Notably, 3/4 of these patients have hypertension, and 72% are affected by mental health issues. There is also a much higher incidence of dementia, diabetes, cancer, and kidney conditions among home care patients. Once the response to COVID-19 began to dwindle, we made the strategic decision to repurpose our COVID infrastructure into community-based primary care settings or pop-up clinics. In 2023, we successfully deployed 3 pop-up sites, 2 in Montgomery County, St. Rose de Lima and Poolesville, and 1 in Prince George's County, Hyattsville. As the map shows, these pop-up clinics provide comprehensive primary care services to Montgomery, Prince George's, and Howard counties, ensuring that all patients are connected to a dedicated provider. Grief counseling helps individuals navigate the emotional and psychological impact of loss, offering support as they forge new meaning in their lives. Many of the individuals we serve have experienced loss, whether it's the loss of loved ones, jobs, cultural identity, or family as they came to the U.S. Our grief counseling program is a comprehensive behavioral health initiative that expands screening efforts and offers a multimodal treatment approach, including medication prescribed by primary care providers and specialized grief counseling. Overall, 95% of individuals were screened for at least one behavioral health condition, with 82% screened for depression, 94% for alcohol use, and 79% for anxiety. Among those screened, 12% tested positive, two-thirds for alcohol use, one-fourth for anxiety, and 13% for depression. Regarding treatment, 79% of individuals diagnosed with anxiety or depression opted for medication, while 61 individuals engaged in grief counseling, attending an average of 3 appointments with a range from 1 to 19 sessions. Let's review the organization's financial situation for 2023. The total revenue amounted to $767,856, while total expenses reached $1,829,767. In the statement of activity, contracts emerged as the highest source of revenue, generating $355,967, followed by health insurance contributions at $220,203 and grants at $90,044. On the expense side, staffing costs were the most significant, accounting for 84% of total expenses, followed by technology-related expenses. By the end of 2023, the organization faced a deficit of $1,051,911. In the statement of financial position, the assets totaled $170,152, while the liabilities stood at $40,668, resulting in a total equity of $129,583. We would like to conclude this report by expressing our deepest gratitude to those who supported our work through partnerships, grants, and donations in 2023. These generous contributions came from the Maryland Community Health Resource Commission, the Community Foundation, Direct Support for Immigrants, CASA, the Healthcare Initiative Foundation, the Eugene B. Casey Foundation, WUMCO, and the Adventist Healthcare Foundation, as well as from many individual donors. Your support has enabled us to continue this important work, and for that, we sincerely thank you. Let's conclude this report by looking toward the future. Your support is essential for us to continue our work. A donation of any amount will help us expand our programs and reach even more individuals in need. Thank you for considering a contribution to our mission.